The following items are needed for obtaining a face bow registration: earbow portion of the face bow with sterilized bite fork, a cotton roll for stabilizing the bite fork in the patient's mouth. For this demonstration, we are using base plate wax, a barred Parker, and a medium for heating the wax. The top side of the fork is indicated by the raised metal button. This will align the face bow fork stem to the patient's left. We will begin by preparing the bite fork for the registration. By using a sweeping motion, apply an even distribution of heat to both sides of the base plate wax. As you are heating the wax, look for the first sign of gloss. This will indicate the proper temperature for working with the wax. Fold the wax in half to acquire enough thickness to capture the cusp tips. Seal the edges of the folded wax so that the two halves do not separate from one another. It may be necessary to reheat the wax once it's been folded for proper adaptation to the face bow bite fork. Using the raised metal button to indicate the top side of the fork, begin to adapt the wax. Press firmly to mold all four corners of the wax so that it conforms to the fork. Complete adaptation of the wax to the fork will keep the wax from separating as you remove the registration from the mouth. Most likely the wax has cooled to room temperature by now. In order to capture the cusp tip indications, you will need to rewarm the wax. Keeping patient comfort in mind, it is especially important not to overheat the wax at this point. Remember our earlier tip? Look for the first sign of gloss to indicate the proper working temperature. Carefully place the bite fork into the patient's mouth. Align the midline mark of the fork indicated by the raised metal button with the patient's mid-facial plane. Gently press the bite fork against the upper teeth to form an impression of the cusp tips. Avoid perforating the wax by applying too firm a pressure. Inspect the wax to ensure there are no perforations, only the cusp tips have been captured, and there are at least 3 points of contact. If you're using base plate wax, it's recommended that you cool the registration prior to placing it back into the patient's mouth. If you're working alone, a cotton roll placed in the premolar area will help support the bite fork as you're making adjustments to the face bow registration. Hold the clamp assembly with your right hand while the left hand holds the ear bow. Tilt the bow away from the patient's head as you guide the number 3 clamp onto the fork stem at least 3/4 of the distance towards the patient. Position your thumbs inside the bow and near the earpieces to expand the bow. In one smooth motion, expand the bow and seat the earpieces into the patient's external auditory meatus. The clamp number 3 on the bite fork stem self-centers and corrects the anterior-posterior difference. Gently palpitate the lower border of the orbital ridge, locating the infraorbital notch. This is our 3rd point of reference. Tighten the screw to carefully position the orbital pointer towards the orbital notch. To align the ear bow with the 3rd point of reference, place your middle finger under the vertical rod while supporting the clamp with your thumb and index finger. Raise or lower the vertical rod with your middle finger while supporting the ear bow with your left hand. This elevates the pointer and the bow until the pointer is parallel to the orbitale. Now the face bow is in the correct position. While tightening the vertical clamp number 1, Hold clamp number 3 to maintain your position. Before making any other adjustments, store and lock the orbital pointer in its resting position to ensure the safety of the patient. Support the stem of the bite fork with your middle finger. Lightly tap the right and left side of the horizontal rod. This allows the face bow to self-center on the patient. While supporting the ear bow with your left hand to prevent torque, tighten the horizontal clamp number 2. Finally, tighten clamp number 3, which locks the position of the bite fork stem. With our registration complete, now you can remove the face bow from the patient. While expanding the ear bow halves gently, remove the assembly. Remove the transfer clamp assembly from the ear bow. To avoid the risk of losing the registration you just captured, we're going to firmly tighten the clamps. While supporting the vertical rod, secure clamp number 1, 2, and 3. Properly disinfect the registration. Once you've allowed for the recommended disinfectant time to occur, you're ready to mount your maxillary cast or send it to your dental laboratory. Before you mount the maxillary cast, the following items are needed: face bow registration with mounting platform, articulator, mounting plates, maxillary cast properly trimmed and indexed, rubber bowl, mixing spatula, water graduate, barred Parker or knife, sandpaper, and mounting stone or plaster. Inspect the bite registration for occlusal interferences. You may need to trim any excess material that will interfere with an accurate seating of the cast. Carefully inspect the occlusal surface of the maxillary cast. The goal is to have even tooth to record contacts. When seated, there should be no movement of the cast. For this to occur, you may need to remove any nodules on the occlusal surface. If you haven't done so already, you will need to add retention grooves to the surface of the cast to ensure you have proper retention between the cast and the mounting stone. Soak the cast in a bowl of water for 2 to 3 minutes to wet the cast surface. This will allow the mounting stone to adhere to the base of the cast. In preparation for mounting the maxillary cast, you'll need to neutralize the articulator. By using the thumb nut on the condylar guide assembly, rotate the condylar inclination to 30 degrees on both the right and left condylar guide assemblies. Lock the thumb nut into place. Next, you'll need to set the progressive side shift for both right and left sides. Adjusting the large black knob on the condylar guide assembly, rotate the condylar guide to 30 degrees and lock in place. Repeat this step on the opposite side. To keep the upper and lower member of the articulator parallel while mounting the maxillary cast, set the incisal guide pin to the 0 mark. This is indicated by the thick black line. Loosen the small black knob to make adjustments in the incisal guide table to the flat 0 position. Retighten the small black knob to lock in place. The mounting surface should be free of any wax, plaster, or debris before attaching any plates to the articulator. In this demonstration, we're using the magnetic system. Attach the magnetic converter plate by aligning the plate with the pins and lock into place with the black thumb screw. Make sure that the converter plate is flat against the upper member. Now you're ready to attach the disposable mounting plate to the magnetic converter plate on the upper member. When using the indirect mounting technique, we'll need to use the mounting platform to mount the maxillary cast. We'll begin by attaching the mounting platform to the lower member of the articulator. Align the platform with the mounting pins and lock into place with the black thumb screw. Insert the transfer clamp assembly into the mounting platform. The black O-ring should be flush against the top surface. Lock into place using the thumb screw. Using a maxillary cast support prevents flexing of the bite fork registration during the mounting procedure. Raise the horizontal bar until it makes light contact against the bottom of the fork and lock into position. Flexure of the fork will position the maxillary cast in a different position than captured during the face bow registration. The maxillary cast should be stable in the bite record. As you close the upper member of the articulator, verify that you have enough clearance between the cast and the mounting plate to apply mounting stone. The incisal guide pin must be flat against the incisal guide table before you proceed. We're going to use pre-weighed mounting stone to mount our cast. It's important to follow manufacturer's guidelines for correct water-powder ratio. Weigh your stone if you're not using pre-measured powder, and make sure you measure your water. Begin by dispensing the water first. When using the sprinkling method, incorporate the powder into the water. You want to make sure you empty the entire packet. Mounting stone requires 30 to 45 seconds to mix. You'll have a total of 2 to 3 minutes working time, which gives you plenty of time to mount your cast. The specific mix time allows you to fully incorporate the powder with the water, which creates a creamy, smooth, and bubble-free mix. Start by swiping a layer of stone onto the grooves of the mounting plate and into the indices of the cast. Next, add small amounts of material onto the cast, stacking the stone until you have enough material to join the cast and the plate. For easy cleanup, only apply enough stone to join the cast and the mounting plate. Make sure that the incisal guide pin is resting on the incisal guide table as you carefully close the upper member. Before the mounting stone sets, remove any excess material. Allow the mounting stone to set according to manufacturer's guidelines. The mounting stone should be neatly dressed. Presenting aesthetically mounted cast to your patient during treatment planning is a reflection of the quality of work you do. Now we're ready to mount the mandibular cast. Being lean in the lab means saving time. For efficiency, it is recommended that you collect and have available the following materials: magnetic converter plate and disposable mounting plate, mandibular cast properly trimmed and indexed, mounting stone, rubber bowl and mixing spatula, water graduate, barred Parker or lab knife, fine grit sandpaper, glue gun, large paper clips, and of course, you'll need your bite record. Before you begin mounting the cast, carefully inspect the occlusal surface. You'll need to remove any nodules on the occlusal surface before seating it in the record. If you haven't done so already, you'll need to add retention grooves to the surface of the cast to ensure you have mechanical retention between the cast and the mounting stone. Before mounting the lower cast, don't forget to reattach the magnetic converter plate. Then, attach the disposable mounting plate. For stability, the articulator is designed to rest on the knobs when inverted during the mandibular cast mounting. Based on the thickness of your record, you'll need to raise the incisal guide pin approximately 3 to 5 millimeters. You may use a periodontal probe to determine the actual thickness of the record. Carefully place the bite record onto the maxillary cast. Ensure the wax fits immediately against the cast. There should be no rocking or movement of the record. Attach the maxillary and mandibular cast together to eliminate movement. A variety of materials can be used to stabilize the casts. For this demonstration, we're using hot glue and large paper clips. When following this technique, the cast must be completely dry for the glue to stick to the cast. It's important to allow the glue to set before proceeding with the mounting procedure. Remember, if you haven't done so already, score the cast to aid in mechanical retention and hydrate the cast for chemical retention. Before you begin placing the mounting stone on the cast, close the lower member to evaluate the space between the mounting plate and the base of the cast. Always follow the manufacturer's guidelines for the correct water-powder ratio and mix time. Sometimes a two-step mounting technique is required when there's a large amount of space between the cast and the mounting plate. You'll need enough stone to join the cast and the plate. Begin by applying a small amount of stone to the mounting plate, then carefully adding stone to the center of the cast, creating a pillar to connect the cast and the mounting plate. Close the lower member until the incisal guide pin contacts the incisal guide table. After the initial application of the mounting stone is set, which is about 5 minutes, you can add additional stone to the mounting to fill voids. Once the second application of stone is set, take a fine grit sandpaper to smooth the mounting stone, creating a neatly dressed mounted cast. For this articulator, the most commonly used bite record to program the guidance is a protrusive record. We will demonstrate how to set the condylar guidance by using a protrusive bite record. Start by loosening the left and right centric locks, as well as the left and right thumb nuts for the horizontal inclination of the condylar guidance. Raise the incisal guide pin to avoid any occlusal interferences. There are several materials and techniques used for acquiring the patient's protrusive bite record. Regardless of the technique, ensure the record is stable. Seat the protrusive interocclusal record onto the mandibular cast. Carefully guide the upper member into protrusion. Lightly engage the maxillary cast into the imprint of the protrusive record by rotating the left and right guidance back and forth. You'll notice that the anterior teeth will come into contact. Make sure you verify the casts are seated completely without rocking or deforming the record. Record the setting, and then finally tighten the thumb nuts for the horizontal inclination to lock your record into position. Anatomical averages to set the guidance of your Hanau wide view articulator. You may set the condylar inclination at 30 degrees and the Bennett angle at 15 degrees. In summary, the use of dental articulators can truly enhance your private practice by improving the accuracy while decreasing valuable chairside time. The articulator and its ear bow are an excellent tool for patient education and a help in patient acceptance of the formulated treatment plan. The Hanau wide view articulator and spring-bow face bow provide a viable and necessary adjunct to your clinical practice in constructing successful dental restorations.